Hi, I'm Dr. Anoop, consultant in Department of Gastroenterology in Manipal Hospital Whitefield. Today I am going to discuss about the management options in patients with gastroesophageal reflux disease. So the management of gastroesophageal reflux disease can be subdivided into lifestyle intervention, medical management, endoluminal intervention and surgical intervention. Among the lifestyle modification, we do recommend weight reduction in patients who are overweight and obese and ask them to avoid trigger foods and have their last meal at least 2 to 3 hours before their bedtime, and also elevation of head into the bed. These are some of the lifestyle modification which might help in alleviate the symptoms of GERD. Coming to the medical management, the mainstay of the medical management in patients with GERD is proton pump inhibitor, which is basically which suppresses the acid production in the stomach. In patients with established GERD, we give what you call it as trial of proton pump inhibitor for a duration of 8 weeks, which can be both diagnostic and also therapeutic. So after the 8 weeks of therapy, we reassess the symptoms, and depending on the response to the therapy, we decide whether patient needs any further management or any other interventions. There are some subcategories of GERD where we might have to give this proton pump inhibitors for a very long duration, especially in patients with severe erosive reflux esophagitis and also Barrett's esophagus, or if the patient has peptic esophageal strictures. There are latest advances in the management of GERD among the endoscopic interventions like TIF, which is also called as transoral incisionless fundoplication. So we have to carefully select patients for endoluminal interventions, especially those who have a very small hiatus hernia and who needs acid suppression medication for a longer period of time. The advantage of endoluminal interventions are these are less invasive and they are devoid of some of the rare complications of surgical interventions like difficulty in swallowing and gas bloat syndrome. The advantages of endoluminal interventions are the recovery time post intervention is very short, and patient can get back to their daily routine within 24 to 48 hours post procedure, and length of the stay in the hospital is also short. To mention few among the endoluminal interventions, there is a ARMS procedure, there is a ARMA procedure, there is a Stretta procedure, and there is a transoral incisionless fundoplication. Among the surgical interventions, the standard procedure which we do for GERD is Nissen's fundoplication, which we have to carefully select these patients depending on the endoscopy, reflux monitoring, testing, and this surgical intervention especially helps in patients with significant hiatus hernia and those who have advanced or severe grade of GERD, and especially those who needs long-term acid suppression medication. But we have to carefully select these patients based on the comprehensive evaluation including endoscopy, reflux monitoring, testing, and also a response to the therapy. Thank you.